A lot of people are concerned about the safety of a vaccine that's been developed relatively rapidly. Whenever something is introduced by, say, the government, which says this is good for you and it's going to make you better, the people of the African American community pause and wonder if we're being used as guinea pigs. So these are things we have to address and try to allay fears that the vaccine is indeed safe, it is indeed effective, and African Americans have been included throughout the process, including Latinx citizens. We have Latinx citizens as part of our church as well. I've taken it myself, and so I just believe that the data supports that this is a safe vaccine. I'm a healthcare provider, and I'm exposed to COVID-19 quite extensively in the work that I do outside of the church. And I have hypertension and I have diabetes. I'm also 58 years old. All right, so I'm in that category where bad things can happen. And so I wanted to be sure that I was protected as much as possible. Taking the vaccine is really an act of love. And our Christ taught us that we should love one another. In fact, before he went back to be with his Father after his resurrection, he said, "A new commandment I give unto you, that you love one another." And knowing that we're going to need some 70 to 80% herd immunity, if you will, then all of us who can should take the vaccine so that we can protect our entire community. If we can achieve that, then we can get to the point where we're no longer having to wear masks and gloves and social distance. Now, we're a long way from that, admittedly, a very long way from that. But if we can achieve that degree of immunity within the community, it will allow us to get back to a sense of normalcy. It will reduce the number of patients in our hospitals, reduce the stress on our hospital staff, clear up room in the morgues, all right? All of those things we can achieve if all of us who can and will go ahead and take the vaccination. It's your decision, it's not mine. I can't force you, nor will I even try to say to you that you have to and you must take the vaccine. We are in a situation where we are using a vaccine that has been given emergency use authorization, not a license by the Food and Drug Administration. So I understand that there may be some concerns. However, I would appeal to you to think about how you are exposed to a potentially deadly virus and what you could do to help reduce the spread of the virus, not only for yourself personally, but for your family and your community. I always say it's raining outside. It's basically raining COVID-19. The vaccine is an umbrella. It's not perfect, because the wind could come and take the umbrella out of your hand, or you could get struck by lightning, even if you're carrying the umbrella. But here's the deal. It's raining so much COVID-19, if you go out without the umbrella, you're sure to get wet. I would like to say to the members of our community, our African American friends, our Latinx friends, our Native American friends, listen, we've got to really, really take this seriously. We are the ones who are most at risk of developing a severe infection and dying from this virus. And because it is such a deadly virus, and so many people, over 370,000 people have died from this, we in particular need to access the vaccine and get vaccinated, if at all possible. I really implore you to do that, my brothers and my sisters, and I believe that we'll be protected and that the Lord will be pleased.